Hey everybody, Dr. Todd here at Gonstead Spine and Wellness. I'm here on a Saturday. I actually came in today and saw two patients that were in pretty bad shape. They were new patients to our clinic. One of them came in as a referral from a medical doctor here in the area at urgent care. He saw this girl, she had a torticollis, so she was stuck to the side with her neck. She woke up like that this morning. Actually, she woke up stiff and sore. Felt a grinding in her neck move, got stuck to the side. 19-year-old female, severe pain. They didn't know what to do, so they went to urgent care. This medical doctor over there who knows about our clinic, knows that we do great work, and actually reached out to me on my cell phone, called me, and I said, okay, let's do this. So we came in, and I just finished up with this young girl and her mom. They're both very grateful. It was really an interesting case, and she gave me permission to show a picture of her. So I'm going to share that picture. I haven't uploaded any of this stuff yet. This is fresh. I'm going to get home to my family. I just wanted to share this briefly. But this is her initially. And you can see how stuck to the side as she is with her head. Okay, she could barely straighten out at all. This is her right after we worked on her, after an adjustment. So this is after adjusting one segment in her spine. One segment. That's the difference in the Gonstead work, is that we're trying to find where there's pressure on a nerve. We're not trying to just mobilize and stretch out and work on everything in the entire body, but we want to find that one spot because we know that's going to get the best result for our patient. So here's her x-ray over here, and as you can see, she is not so straight. So she is completely bent to the side. When we go through and we do an exam here, which is really a cool part of how we work, and this works with any patient no matter what's going on with them, we check them on the surface of the skin with an instrument. So that instrument measures temperature from side to side. If it gives us a reading, it helps us find where the problem is. So this is in the instrument. And then we make a mark on the surface of the skin with a skin marking pencil. And that's one criteria. Another criteria we look for is we palpate for swelling, muscle tension. She was so acute, we could not move her very well at all. So motion wasn't going to tell me a whole lot. And then we take BBs and we tape the BBs on the surface of the skin where we find a problem. So we have different size BBs in here, as you can see. We tape these, then we go through and we shoot an x-ray. Take a very specific type of x-ray as well. We analyze that film. So the way that we look at this in the Gonstead analysis, if you can see, she's bent over to the right. This is the right, this is the left. We're looking at her as if we're standing behind her. And when we numbered these vertebrae C2 down to C7, there's 7 bones in the neck, and then T1 down to T8. We took actually just a partial view here. There's other reasons that we couldn't x-ray her entire spine. We had to just x-ray a section in this case. What we found here is that the entire spine is bending this direction. Likely irritation to a nerve on this side is what you would originally think, and then she's bending this way to open that space up and get pressure off of the nerve. But in this case, that wasn't exactly necessarily the only reason that was going on. So after we saw the x-ray and I'm looking at this and I'm applying the specific Gonstead analysis, you can see that everything opens up on this side, bending this direction. And we get down here and we find right in this area, it doesn't look so right, specifically T5. The way T5 sits on T6, it's actually bending to the left. So if I blow that up, you can see that a little easier. So T5 on T6 bends this way, to the left. Doesn't make sense because everything else is bending this way. So you know that one just does not fit. We put her face down on a high-low table, specifically contacted that fifth thoracic. Her mom actually helped by stabilizing her head. I mean, super acute, almost in tears. And we set this very precisely. One clunk, one bone moved. And just with her laying on the table, she said, well, I can already tell that a lot of the pain's going away. We brought her upright and she was in a completely different position following this. So I'll show you again. I mean, this is literally a few minutes after. I mean, this is at the beginning of the exam before we shot x-ray and really went in detail on the left there. And then on the right, you can see how much she straightened up instantaneously after one specific Gonstead adjustment. So I wanted to share that case on a Saturday and hope you have a great weekend, and we'll see you next week.